Hello, it is Ryan, and I was on a flight the other day playing one of my favorite social spin slot games on ChumbaCasino.com. I looked over at the person sitting next to me, and you know what they were doing? They were also playing Chumba Casino. Coincidence? I think not. Everybody's loving having fun with it. Chumba Casino is home to hundreds of casino-style games that you can play for free anytime, anywhere, even at 30,000 feet. So sign up now at ChumbaCasino.com to claim your free welcome bonus. That's ChumbaCasino.com and live the Chumba life.
No purchase necessary. VGW. Void where prohibited by law. See terms and conditions. 18+.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go to reallifepharmacology.com. Pick up your free PDF. It's a 31-page PDF on the top 200 drugs. Great resource, just a refresher if you're out there in practice or if you're in school taking pharmacology classes. I've highlighted some of the most important things that come up in practice, as well as things that come up on exams in that PDF. So, again, absolutely for free. Simply just subscribing to the podcast. We let you know when we've got new updates and other content available there. So, again, reallifepharmacology.com is where you can find that free top 200 study guide. All right, so let's get into the drug of the day today, and that is phenazopyridine. I've had a couple of people ask me about this in the past, so I wanted to cover it definitely and give my thoughts on the drug. But just a little bit of a basic background. Brand name, you'll hear patients refer to the drug as Azo. Occasionally I have heard the older brand name Pyridium as well. And this medication does kind of scare me a little bit for medical purposes. So this drug is used for urinary pain relief. So patients having difficulty, painful type urination, and the drug is classified as a urinary analgesic, basically. Mechanistically, it's really not well understood how it helps with that, other than it's suspected to provide some sort of analgesic or anesthetic type action on the urinary tract. Again, not really well understood on that mechanism of action. Dosing of this medication, we're typically going to give this with food, usually dose a tablet or two, up to 3 times per day. And the reason why it's given with food, of course, there is small potential for a little bit of GI upset and that type of thing. Other potential adverse effects, possibly some CNS stuff has been reported, headache, dizziness, things like that. Rare adverse effects that have shown up in case reports, things like that. Methemoglobinemia, hemolytic anemia, acute renal failure, hepatitis. And I wanted to pull out a couple specific examples of where this might be more prevalent, or some of these rare adverse effects might be more prevalent. So hemolytic anemia, so patients who are G6PD deficient, they may have a higher risk of that. Methemoglobinemia, definitely talk about that with drug interactions. And then with this medication, it's important to remember that a significant chunk of it is excreted, eliminated through the urine, which makes sense, right? It works in the urinary tract. The drug itself does, so we've got to have some adequate kidney function to get that drug there. So what that means from an adverse effect profile is some of the rare things may be more and more likely as we get worse and worse renal function. So as that renal function declines, the accumulation of the drug can happen, and we may get to a situation where we've got greater risk of things like hepatitis and renal failure and hemolytic anemia and all that stuff. So definitely remember that with Azo. And if patients are dead set on using it, definitely make sure that they have adequate renal function to help prevent possible accumulation. One last kind of rare, it's generally not harmful or painful, but it can definitely scare patients a little bit, and that's changes in the color of the urine. So it may give kind of a reddish, orangish tinge to the urine. And so that can definitely throw off patients and make them upset, definitely. So definitely something, if a patient's going to use that, or if they come and report that their urine has changed colors, definitely azo is a good one to ask about and make sure that they aren't taking that medication, which can cause that change in urine color. Pharmacokinetic standpoint, I mentioned that the drug is primarily eliminated by kidney function and out through the urine, of course, there. So approximately 66% of the drug is eliminated from the body unchanged through urinary excretion. So again, that kidney function is going to be really, really important in making sure that we're clearing the body of this drug. And just from a practical standpoint, what's considered the cutoff line maybe for when to use this, when not to use this. I would say there's not a hard fast rule on this, but I have seen less than 50 mils per minute GFR kind of reported as that cutoff line for using this medication or not using this medication, obviously, if they're under that cutoff line. And our geriatric patient population that I work with, certainly they're at much greater risk for poor kidney function. One last education point that patients need to understand, okay, this drug does not treat an active urinary tract infection, okay? Patients are going to be tempted to try to utilize over-the-counter remedies and things like that. And honestly, when I see a patient asking about azo or wanting to use phenazopyridine, I get a little nervous because I'm definitely worried that there might be something medically going on if they're having painful urination or discomfort when they're going to the bathroom. So if you happen to work in a pharmacy, or somebody's asking you about could I potentially use this, it's really recommended to use it for no more than a day or two. And if symptoms aren't improving, or if things are getting worse, it's like, okay, there's probably something more serious going on, and we need to evaluate those patients from a medical standpoint there. So I definitely have a healthy fear when patients ask about this drug, or I see them using it, because I want to make sure that there's nothing else going on, and that they actually have been evaluated for potential urinary issues and things like that. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material like BCPS, ambulatory care, geriatrics, BCMTMS, the NAPLEX exam, go check out meded101.com/store. Growing list of resources there to help you prepare for those exams. Also, if you're a nurse practitioner, med student, other healthcare professional that enjoys learning about medications, we've got lots of different Amazon books and resources that may fit something that you're looking for, whether it's drug interactions, case studies, clinical reasoning. Definitely we've got a lot of options there, and obviously your support there at meded101.com/store helps keep this podcast free and educational for all to benefit from. So again, go check out meded101.com/store and support our sponsor. All right, finishing up with drug interactions, and the one great thing about a drug that is generally highly excreted in the urine is oftentimes we don't have a lot of drug interactions. Particularly, I think of the liver and CYP enzyme system. Phenazopyridine doesn't really mess with that to a significant extent, and we're not going to have many drug interactions that way. So that is definitely a good thing. With other drugs, I think about drugs that can cause acute renal failure potentially, or we run into a situation where we've got a drug-induced renal impairment, and recognizing that azophenazopyridine can potentially accumulate in that situation and may be more likely to cause adverse effects if we get to that accumulation type situation. The only other thing that I think about with drug interactions and phenazopyridine is methemoglobinemia risk, and that's usually in combinations with maybe drugs that have a higher likelihood of causing this issue, and typically that's going to be associated with local anesthetic type drugs. Some of the canes, for example, like prilocaine, can cause methemoglobinemia, and that may be aggravated or exacerbated by using phenazopyridine with those type of medications. So that's going to wrap up drug interactions. Not too much there. If you enjoyed this podcast, found it helpful, please leave us a rating review on iTunes. I'm so thankful for those of you that have already done that. I think we're up well over 400 ratings and reviews at this point, and it's incredible. And honestly, it helps me keep going. I love medications. I love what I do as a pharmacist, and just being able to help large numbers of people learn medications better is really, really gratifying and rewarding to me. So I'm greatly appreciative for all the kind ratings and reviews that I've received over the few years I've been doing the podcast now. So again, if you haven't done that, and if you've found the podcast helpful and beneficial to you, I'd greatly appreciate it if you did that. If you want to reach out to me, suggestions, or track me down for questions, anything like that, mededucation101@gmail.com, or LinkedIn is probably where I'm most active. Eric Christensen, PharmD, BCGP, BCPS. So please don't hesitate to reach out there if you've got a comment, suggestion, or anything else on your mind there. With that, I'm going to sign off for today. Thank you so much for listening, and I hope you have a great rest of your day.
Purchase new wiper blades from O'Reilly Auto Parts today and we'll install them for free. See better and drive safer with O'Reilly Auto Parts.
O'Reilly Auto Parts.
Hey guys, it is Ryan. I'm not sure if you know this about me, but I'm a bit of a fun fanatic when I can. I like to work, but I like fun too. It's a thing. And now the truth is out there. I can tell you about my favorite place to have fun. Chumba Casino. They have hundreds of social casino style games to choose from with new games released each week. You can play for free anytime, anywhere. And each day brings a new chance to collect daily bonuses. So join me in the fun. Sign up now at ChumbaCasino.com.
No purchase necessary. VGW Group. Void where prohibited by law. See terms and conditions. 18+.